My name is Sarah and this is my first presentation submission for HNN313 perioperative nursing, in which I will be discussing how effective communication between the multidisciplinary team in the perioperative context is essential to ensure high quality clinical decision making, specifically in relation to the safety issue of handover. The Nursing and Midwifery Board 2016 suggests that person-centered care is a collaborative and respectful partnership built on mutual trust and understanding through good communication. Patient safety is a national health priority, as advised by the National Safety and Quality Healthcare Standards. Coleman et.al. recognised that patient handover is the most used form of clinical communication in the acute setting and is a renowned source of risk to patient safety. Nurses play a critical role in ensuring these standards are met and therefore improving the safety and quality of patient care. In the case of handing over in the perioperative setting, it is the perioperative nurse's role to ensure the needs are met of the patient and the receiving nurse in terms of all information being received, understood, and clarified if required. As discussed by Melly and Blakeney, 2015, the perioperative environment is dynamic and involves multidisciplinary teams, all with competing tasks, which rely on how well information is conveyed and how well these team members communicate the information to and amongst each other. Risk for communication error is increased in this setting due to high patient turnover and environmental distractions, and therefore transitions of care in the perioperative environment can be considered high risk, as the transfer of care can be particularly prone to communication failures and ultimately loss of information, posing significant threat to patient safety. Standard 6, Clinical Handover, in the National Safety and Quality Healthcare Standards 2011, intends to ensure there is timely, relevant and structured clinical handover that supports safe patient care. Nursing Standards Journal 2015 discussed how within multidisciplinary teams, the sharing of information regarding patient care requires teamwork and effective communication. Poor teamwork can result in mistakes, for example when there is a breakdown in communication and team members address and react to information and situations differently. This may affect diagnosis, delay treatment and effective administration of medication and therefore patient safety. Poor communication within the handover process has been identified as an important contributing factor to serious adverse events. Effective communication within the multidisciplinary team, specifically between the ward nurse and the preoperative nurse, can reduce the causation of patient harm. Clinical handover is an essential element to ensure a safe and high quality healthcare delivery. Current handover processes are highly variable and may be unreliable, causing clinical handover to be a high-risk area for patient safety. Breakdown in the transfer of information has been identified as one of the most important contributing factors in serious adverse events and is a major preventable cause of patient harm. It has been shown that critical information is more likely to be transferred accurately and effectively acted on through standardized and structured communication during the handover process.